Hey guys, Dr. Ross here at Inver Chiropractic, and as you guys know, we're talking about sciatica this week. And sciatica comes from the nerves that form in the lower portion of our spine. They come out, form that sciatic nerve, and go and travel all the way down our leg. And when they get pinched in our low back, especially, which is what I'm talking about today, is arthritis, degeneration, and disc herniations, it can cause a lot of pain, a lot of discomfort, and it can really change people's lives over the course of anywhere from 2 to 20 weeks, depending on how long it takes to get that corrected, because sometimes it can take a little bit of time. But some of the things that we do in office to speed that up and give you guys as much pain relief as possible is intersegmental traction and inversion table. So inversion traction is this machine that we have here, and you've seen the infomercials of when you're hanging upside down. We do it a little bit different, and we pair it with something called electrical stimulation. So electrical stimulation, we hook up some electrodes down to your low back, because when you get sciatica, a lot of times those muscles get really spastic and really tight. It's going to help those muscles settle down and relax, and it also produces some natural painkillers in your body, which can really help, especially in the short term. But what happens is with the inversion table is you get hooked up in here, and then we tip you, and we start out just going a little bit past parallel. And what happens is you can see this traction's down, and it pulls those disc spaces apart, giving those nerves a break, and it takes that pressure off. And a lot of times this feels amazing for the patient because they don't have that impingement, whether that's from a disc herniation or just from arthritis and inflammation. And we lay you down for a few minutes, but then we flatten you back out and give it a break. So we want to pump that disc back and forth. And we do this for about 10 to 15 minutes along with the electric stim to give you as much relief in the short term. But what this is going to do, it's going to help with that pain, especially in the long run. Try to pump those disc spaces back up, suck up that herniation as much as you can. The other thing that we use is an intersegmental traction table, and we can use ice or heat on here as well. But an intersegmental traction table, what that does is it's got a little roller that goes all the way up and down your spine, and it's going to help open up those disc spaces. And again, try to suck in as much water and nutrients in there, so it creates mobility in the short term, but then it creates function in the long term with drawing in water to try to keep those disc spaces as healthy as we can. So here's just 3 different things that we do in the office: the intersegmental traction table, the inversion table, and then the electrical stimulation. And the combination of the 3, along with other videos that we have showing the adjustments, nutrition, and a bunch of different things that you guys can do, can go a long ways with speeding up sciatic recovery, and then especially if we're having some permanent changes with arthritis and degeneration, preventing that sciatica from coming back over and over again. So if you have any questions, go ahead and ask them below in the comment section. If you like the video, click the like button and share the video. We'd greatly appreciate that. And if you guys have any questions, don't forget, comment below. Have a wonderful day, and we'll see you guys soon.